Good morning, everyone. Thank you so much for taking the time to join me today. I'm going to be honest with you right from the start. I've been practicing medicine for over 20 years, and if there's one thing that frustrates me more than anything else, it's watching my patients struggle with something that's been misdiagnosed, oversimplified, and frankly sold to them as a problem that simply doesn't exist the way they've been told it does. And that something is high blood pressure. Now, before you close this out or reach for that shaker of salt on your kitchen counter, hear me out. I'm not here to tell you that salt doesn't matter. I'm not here to dismiss the conventional wisdom entirely. What I am here to do is pull back the curtain on what's really going on inside your body when your blood pressure starts creeping up. And I can almost guarantee you that the real culprit isn't sitting on your dinner table. It's sitting right here, in your life, in your habits, in your stress, and in the choices you're making every single day without even realizing the impact they're having on your cardiovascular system. Let me start with something that will probably shock you. We've been blaming salt for high blood pressure for decades now. The American Heart Association tells people to limit their sodium intake to less than 2,300 milligrams per day. That's roughly a teaspoon of salt. And you know what? For the vast majority of people with high blood pressure, this recommendation has done almost nothing. In fact, some studies are showing that severely restricting salt actually increases cardiovascular risk in certain populations. Yes, you heard me right. The very thing we've been telling people to do to protect their hearts might actually be making things worse for some of them. So, if it's not salt, then what is it? Well, let me tell you. The answer is far more complex and far more actionable than most people realize. Your blood pressure is high because of a symphony of factors that are all playing together. And yes, salt might be one instrument in that orchestra, but it's hardly the lead violin. The real reason your blood pressure is high is multifactorial, and once you understand these factors, you'll finally have the tools to actually do something about it. Let's talk about stress, because this is where the rubber really meets the road in my practice. I see patients every single day who come in with elevated blood pressure readings, and when I start asking them about their lives, the pattern becomes crystal clear. They're stressed. Not just a little bit stressed, they're chronically, persistently, unrelentingly stressed. They're stressed about their jobs, about their finances, about their relationships, about the state of the world. And here's what's happening biochemically. When you experience stress, your body releases cortisol and adrenaline. These hormones cause your blood vessels to constrict, your heart to beat faster, and your blood pressure to rise. This is the fight-or-flight response, and it was incredibly useful when our ancestors were running from predators. But in modern life, we're not running from anything. We're sitting at desks, checking our phones, scrolling through social media, reading news alerts, and our bodies are stuck in this constant state of activation. Now here's the thing that really matters. This isn't a one-time event. This isn't something that happens and then goes away. If you're stressed chronically, and I mean really chronically, day after day, week after week, year after year, your blood vessels start to remodel themselves. They become stiffer, they lose their elasticity, and that means even when you're not actively stressed, your baseline blood pressure is elevated. You've essentially trained your cardiovascular system to run at a higher pressure all the time. This is why I tell my patients that stress management isn't just good for your mental health. It's absolutely critical for your cardiovascular health. But stress isn't the whole story. Let's talk about sleep, because this is something that's criminally underemphasized in the discussion around blood pressure. I want you to think about what happens when you don't get enough sleep. Most people think, oh, I'll just feel tired tomorrow. But that's not actually what's happening. When you don't sleep enough, your body doesn't get the opportunity to regulate its blood pressure. Your sympathetic nervous system, the one that keeps you alert and ready to respond, stays activated. Your parasympathetic nervous system, the one that's supposed to help you relax and recover, never gets a chance to take the wheel. Sleep is when your blood vessels get to relax, when your heart rate drops, when all the wear and tear from the day gets repaired. Without adequate sleep, you're basically running your cardiovascular system constantly at elevated levels. And it gets worse. When you're sleep deprived, your body produces more cortisol and adrenaline, which means you're amplifying that stress response I just talked about. You're also more likely to make poor dietary choices. You're more likely to reach for that coffee or energy drink. You're more likely to skip exercise. Sleep deprivation is like a gateway drug to all the other things that raise your blood pressure. I have patients who've told me that simply getting one more hour of sleep per night, going from 5 hours to 6 hours, has moved their blood pressure from the hypertensive range into the normal range. 1 hour. That's how powerful this is. Now, let's talk about exercise, or more accurately, the lack thereof. The human body was designed to move. We weren't designed to sit all day, and yet the average American is sedentary for more than 7 hours a day. 7 hours. When your muscles aren't being used, they atrophy, they become less efficient at processing glucose and fatty acids, and your cardiovascular system has to work harder to deliver oxygen and nutrients. But here's what's really important. Exercise doesn't just improve your physical conditioning. It's also one of the most powerful stress reduction tools available to you. When you exercise, you're releasing endorphins, you're burning off excess cortisol, you're giving your body a constructive way to process that fight or flight response that's been building up all day. I have patients who've told me that going for a 30-minute run or bike ride does more for their blood pressure and their overall sense of well-being than any medication could. But I want to be specific about this because not all exercise is created equal. High-intensity exercise is fantastic for cardiovascular conditioning, but if you're doing high-intensity workouts when you're already chronically stressed, you might actually be adding to your stress load rather than alleviating it. That's why I recommend a balanced approach. Some aerobic exercise, some strength training, and some lower-intensity activities like walking, yoga, or Tai Chi that activate your parasympathetic nervous system and help you actually relax. The goal isn't to exhaust yourself. The goal is to move your body consistently in ways that improve your cardiovascular health and reduce your stress. Now let me talk about something that nobody wants to hear about: weight and metabolic health. I know, everyone's tired of hearing about weight. But here's the thing: excess body weight, particularly abdominal fat, is directly linked to high blood pressure. And it's not just about weight, it's about metabolic health. You can be overweight and metabolically healthy, and you can be at a normal weight and metabolically unhealthy. But what matters for blood pressure is how your body is processing energy and how your metabolic system is functioning. When you're overweight, especially if that weight is concentrated in your abdomen, your body is producing more inflammatory markers. Inflammation is a huge driver of high blood pressure. It damages your endothelial cells. Those are the cells that line your blood vessels, and it makes your blood vessels stiffer and less responsive. You're also more likely to have insulin resistance, which means your body isn't responding properly to insulin, and that causes your blood pressure to rise. This is why weight loss, even modest weight loss of 5 to 10% of your body weight, can have a dramatic effect on blood pressure. I've seen patients drop 10 to 15 points just from losing 15 pounds. But here's where most people get it wrong. They think they need to go on a restrictive diet and count calories obsessively. That's not necessarily what we're talking about here. What we're talking about is changing the quality of the foods you're eating. Because that brings me to one of the biggest factors in high blood pressure that gets completely overlooked: diet quality, not just salt content. Your diet is absolutely critical to your blood pressure, but not because of salt. I mean, yes, if you're consuming massive amounts of processed foods, you're consuming massive amounts of salt because it's in everything. But the real problem with processed foods isn't the salt, it's what else is in them. It's the refined carbohydrates that cause blood sugar spikes and insulin spikes. It's the unhealthy fats that promote inflammation. It's the lack of fiber, potassium, magnesium, and calcium, all nutrients that are essential for healthy blood pressure regulation. Let me paint you a picture of what I see in my practice. A patient comes in with hypertension. They tell me they don't add salt to their food, so they think they're doing everything right. But then I ask them what they ate for breakfast, and they say a bagel with cream cheese and a coffee with added sugar. For lunch, a sandwich on white bread with deli meat and a bag of chips. For dinner, pasta with jarred sauce and some chicken. That's processed foods from morning to night. That's refined carbohydrates that are spiking their blood sugar and causing their pancreas to overproduce insulin. That's inflammatory seed oils and trans fats. That's the real problem. And I take that same patient and I say, what if instead of focusing on salt, we focus on eating real food? whole grains instead of refined grains, lean proteins instead of processed meats, lots of vegetables, fruits, nuts, seeds. What if we focus on eating foods that are actually rich in the nutrients your body needs to regulate blood pressure properly? When they do that, when they actually change the quality of their diet, their blood pressure improves dramatically, often in a matter of weeks, not months, not years, weeks. And speaking of nutrients, let me talk about magnesium, because this is something that's critical for blood pressure regulation and most people are deficient in it. Magnesium is involved in over 300 enzymatic reactions in your body, including the relaxation of smooth muscle in your blood vessels. When you don't have enough magnesium, your blood vessels can't relax properly, and your blood pressure stays elevated. The problem is that magnesium is found primarily in green leafy vegetables, nuts, seeds, and whole grains, all things that have been depleted from the modern diet. If you're eating processed foods and refined grains, you're almost certainly not getting enough magnesium. And I can't tell you how many patients I've helped by simply making sure they're getting adequate magnesium through diet or supplementation. Similarly with potassium, potassium is essential for blood pressure regulation. It helps counteract the effects of sodium and helps your blood vessels relax. Yet the average American is getting far too much sodium and far too little potassium because we're eating processed foods instead of real foods. When you shift to a diet that's rich in potassium, bananas, sweet potatoes, avocados, leafy greens, beans, you'll notice a difference in your blood pressure. Now, I want to talk about something that's become increasingly relevant in our modern world: alcohol consumption. Many of my patients don't realize that alcohol can significantly elevate blood pressure. I'm not talking about someone who has a glass of wine with dinner a few times a week. I'm talking about regular consumption, daily drinking, or binge drinking. Alcohol is a direct vasodilator initially, which might sound like it would lower blood pressure, but chronically, regular alcohol consumption actually raises blood pressure. It also increases cortisol and interferes with sleep, which we already talked about. And if you're drinking sweetened alcoholic beverages, you're adding refined sugars on top of everything else. This is another area where I see patients make a change, cutting back on alcohol, and their blood pressure improves substantially. Let me also address something that a lot of people don't want to think about: the medications you might be taking. Now, I'm a doctor, and I believe in the appropriate use of medications. Some people absolutely need blood pressure medications. They've had strokes, they have severe hypertension, and medication is necessary and life-saving. But I also see a lot of people who've been put on blood pressure medications when they haven't actually tried addressing the lifestyle factors that are causing their high blood pressure in the first place. And here's the thing: medications often mask the problem without addressing the underlying cause. You take a pill, your blood pressure comes down, but you're still stressed, you're still sedentary, you're still eating processed foods, and you're still not sleeping enough. The medication is treating the symptom, not the disease. What I recommend to my patients is this: if your blood pressure is moderately elevated and you don't have other risk factors, let's try addressing these lifestyle factors first. Let's give it 3 to 6 months. Let's manage your stress, improve your sleep, start exercising, change your diet. And let's see what happens. I've had so many patients do this and find that they don't need medication at all, not because we did something magical, but because we actually addressed what was causing the problem in the first place. Now, there's one more factor I want to discuss, and this is something that's often overlooked in the typical blood pressure conversation: your breathing patterns. Yes, seriously, the way you breathe has a direct impact on your blood pressure. Most people spend their entire lives doing shallow chest breathing, which activates the sympathetic nervous system and keeps you in a state of low-level stress. When you practice deep diaphragmatic breathing, breathing slowly from your belly, you activate your parasympathetic nervous system and you literally tell your body to relax. And your blood vessels relax along with the rest of your body, and your blood pressure comes down. There's actually fascinating research on this. Studies have shown that people who practice breathing exercises regularly have significantly lower blood pressures than people who don't. I have patients who practice just 5 to 10 minutes of slow, deep breathing every day, and it makes a measurable difference in their blood pressure readings. This is free. This requires no medication, no expensive equipment, no special diet. Just breathing differently. Let me also mention something about caffeine, because a lot of my patients are surprised when I bring this up. Caffeine is a stimulant. It increases your heart rate, it increases your blood pressure, and if you're consuming large amounts of caffeine, especially if you're already stressed, you're amplifying that stress response. Now, I'm not saying you can never have coffee again. A moderate amount of caffeine is probably fine for most people. But if you're drinking 6 cups of coffee a day, or if you're consuming energy drinks regularly, or if you're sensitive to caffeine and it makes you jittery or anxious, cutting back is absolutely going to help your blood pressure. The other thing I want to emphasize is this. High blood pressure is a sign that something needs to change. It's a signal from your body that the way you're living isn't sustainable, and most of the time, that signal can be heard and addressed before you ever need medications. Your body is incredibly adaptive. Give it the right conditions, good sleep, regular exercise, a healthy diet, stress management, good breathing habits, and it will normalize its blood pressure. Your body wants to be healthy. It's just waiting for you to give it the opportunity. I want to circle back to something I said at the beginning because it's important. I'm not saying salt doesn't matter at all. If you're consuming massive amounts of sodium from processed foods, that's a problem. But I'm saying that salt restriction alone, without addressing all these other factors, is never going to solve high blood pressure. And frankly, it might make things worse by causing you to eat even less nutritious foods that are low in salt but high in sugar and unhealthy fats. What I'm really saying is this. If you have high blood pressure, you have an opportunity. You have the chance to make changes that are going to improve not just your blood pressure, but your entire quality of life. You're going to sleep better. You're going to have more energy. You're going to feel less stressed. You're going to likely lose weight and feel better in your body. You're going to reduce your risk of heart disease, stroke, kidney disease, and cognitive decline. All of this comes from addressing the real causes of high blood pressure rather than just treating the symptom with medication and salt restriction. And here's what I always tell my patients. Start somewhere. You don't have to change everything at once. Pick one thing. Maybe it's sleep. Go to bed 30 minutes earlier tonight. Maybe it's stress management. Download a meditation app or go for a walk. Maybe it's diet. Cook one meal at home this week instead of eating out. Maybe it's exercise. Go for a 20-minute walk today. Start somewhere and then build from there. Small changes compound over time, and before you know it, you've made a massive transformation in your health. The reality is that most people have the power to control their blood pressure without medications if they're willing to make these changes. And if you do end up needing medications, these lifestyle changes are still going to amplify the effects of those medications and improve your overall health. There's no downside to eating better, sleeping more, exercising regularly, managing stress, and improving your breathing habits. These are all things that are going to improve every aspect of your health, not just your blood pressure. So I want to leave you with this. If you're watching this and you have high blood pressure, don't just resign yourself to a lifetime of medication and salt-free food. Understand that your body is sending you a message. Listen to that message. Make the changes that matter. Address your stress, improve your sleep, move your body, eat real food, and learn to breathe. Because high blood pressure isn't a life sentence. It's an opportunity to transform your health and your life. And that opportunity starts now, with you, with the choices you make today. If you found this information helpful, I'd really appreciate it if you could subscribe to the channel. There's so much more to talk about when it comes to cardiovascular health and living your best life, and I'm here to share that knowledge with you. And please, leave a comment below. Tell me what resonates with you. Tell me what you're going to try first. Tell me about your own experience with blood pressure. Your comments not only help me understand what you want to hear about, but they also help other people in this community who are going through the same thing. We're all in this together, and your voice matters. Thank you so much for watching, and I'll see you in the next one.